Producer Micah with you now. The VA is going the extra mile in these times of pandemic in a way you may not know about. Traditionally, the Department of Veterans Affairs provides veterans health care, benefits, and memorial affairs. But in times of national crisis like COVID-19, they also provide health care services to the nation while still keeping veterans first. It's called VA's Fourth Mission, and here with more is Dr. Jennifer McDonald. She is the Chief Consultant to the Deputy Undersecretary for Health. Good morning.
Good morning. Great to be with you.
We're happy you're with us because this is new to me. Kind of go more into VA's Fourth Mission and what it all entails.
Well, as you mentioned, VA is very well known for delivering health care, benefits, and memorial services. What's not as well known, but critically important to the country, is our fourth mission, supporting the nation in times of national emergency. And oftentimes what that means is supporting communities who are affected by a hurricane or a flood or a fire, as we're doing even now. Sending in our personnel who volunteer to go and help, bringing in our mobile pharmacy units, or delivering care via telehealth to help keep people safe. And what that means during COVID-19 is that we have grown our efforts in unprecedented fashion to be able to support, alongside our federal partners, 47 states, the District of Columbia, and tribal communities as well. I'm a veteran and a physician, and it makes me incredibly proud that VA is able to deliver in that capacity for the country during this time.
So what's the balancing act like when it comes to the Fourth Mission assignments and when it comes to continuing to serve our veterans?
Well, veterans are always our top priority, and it's really thanks to a lot of early and active planning that we were able to use the agility and the breadth of our system. Indeed, VA stretches from New York all the way to Guam, and we were able to use the resources in our system to continue to deliver with excellence for those we serve, and then go above and beyond alongside our federal partners to reach into communities that also requested our help. And as we all know, veterans, of course, are part of those communities, and so it matters to the country and to those we serve that we are supporting their families and their communities as well.
How do you determine which communities receive the help?
Communities and states actually come to the federal government with a request. Sometimes that's through VA, and sometimes that's to others of our partners. We coordinate directly with the Department of Defense and the Public Health Service to determine how to meet a need in a state or community, and a lot of times we do that hand in hand, side by side, and in close collaboration with those governors, senators, and the leaders in those communities to make sure that we're meeting the need and supporting well.
Are there any examples that come to mind of that help? And how does this help and protect American citizens, veterans, and their families?
Yes, so an example would be late one Saturday evening, a request came in from Kansas for ventilators. And within 4 hours, VA was able to be there with the right equipment to support those patients. Another example would be in Florida, when community nursing homes needed support. More than 200 of our staff raised their hands and said, "Send me, I will go," and deployed in teams to support community nursing homes across the state, reaching an estimated more than 8,000 patients. And the last one I'll give is the Navajo Nation. When we recognized that that community was tragically hard hit by this virus and their clinicians had a need for us to be at their side, again, our clinicians volunteered and stood with them to rebuild the resilience in the community and help everyone heal.
Amazing assistance there. What else should we know about the Fourth Mission and how VA is responding to the COVID-19 pandemic?
Well, as proud as I am of our 3,000 personnel who are committed to our mission and who have deployed in support of the country, and as proud as I am of the testing services and the PPE we're delivering to help, the message I'd really love for people to hear, especially as a veteran myself, is that to the veterans listening, we are here for you. We know that veterans are resilient. We know that you're taking care of other people during this challenging time, but we want you to know that when you need care and support, VA is here for you. And we want communities and states to know the same, that alongside our federal partners, if you have a need, we will be at your side.
What's the website for more information?
Yes, thank you for asking. It's va.gov/COVID.
All right, we appreciate you taking out the time this morning. Thank you for your service and enlightening us on what exactly VA's Fourth Mission is all about. For more information about VA's Fourth Mission, just head to va.gov/COVID. The Department of Veterans Affairs is a proud sponsor of Las Vegas Morning Blend.